Hi, my name is Summer Flynn. I'm a Master of Science in Nursing student at Eastern Kentucky University. My concentration of study is psychiatric mental health nurse practitioner. The purpose of this presentation was to review evidence-based research using dialectical behavior therapy, DBT, as an intervention for reducing the risk of suicide in adolescents with self-harming behavior. Define the healthcare problem. Adolescent suicide is a major healthcare problem. Suicide is defined as self-directed injurious behavior with the intent to die as a result of the behavior. It is the second leading cause of death among adolescents worldwide. Many factors can increase the risk of pediatric and adolescent suicide, such as impulsivity, major depression, panic disorder, bipolar disorder, or substance use. Suicide was the second leading cause of death for 10 to 24-year-olds in the United States in 2018. In 2018, suicide was also the third leading cause of death in 10 to 24-year-olds in Florida. In 2014, 3.4 million adolescents ages 12 to 17 received specialty mental health services. Of the 3.4 million adolescents, 56.5% received services for feeling depressed, and 29.1% thought of or attempted suicide. The World Health Organization created Sustainable Development Goals to promote health, including Sustainable Development Goal 3, which was to ensure healthy lives and promote well-being for all ages. The Office of Health Promotion and Prevention developed a program called Healthy People 2020 to set national health initiatives to reduce disease, disability, and deaths. The second health initiative for Healthy People 2020 is to reduce adolescent suicide, as it remains a leading cause of death among young people. Gene Watson's theory of human caring involves transpersonal caring through the nurse-patient relationship. It focuses on caring through healing, nursing interventions, and interactions. Hopelessness and emotional pain are common in depression, which can lead to suicide. Developing a caring and trusting nurse-patient relationship can help patients be open to receiving help. The nurse can use her own experiences and training through a therapeutic use of self to help others. The PICO used for this paper was, in adolescents with self-harming behaviors, how does dialectical behavior therapy compared to treatment as usual affect self-harming behavior within 1 year? Studies reviewed. The first study reviewed was a meta-analysis to determine the effectiveness of dialectical behavior therapy as an intervention for adolescents with recent or repeated impulsive self-harming behaviors such as non-suicidal self-injury. DBT sessions adjusted for adolescents ranged from 2 weeks to 14 months, included a variety of program settings, and included various session types, while the control group received treatment as usual. The study findings revealed a large positive effect, suggesting that completing DBT treatment resulted in adolescents engaging in less self-harming behaviors. Next, a randomized controlled trial was conducted to determine the effectiveness of dialectical behavior therapy, DBT, adjusted for adolescents as an intervention for adolescents with recent or repeated impulsive self-harming behaviors, such as non-suicidal self-injury. The intervention group received 19 weeks plus 1 year of follow-up treatment of DBTA, whereas the control group received 19 weeks plus 1 year of follow-up treatment with enhanced usual care. It was reported that there were no suicides during the follow-up period, and after 19 weeks of treatment, patients receiving the DBTA had a significantly lower rate of suicidal ideation and self-harm than the patients receiving enhanced usual care. Lastly, a qualitative study was conducted to evaluate the treatment acceptability and helpfulness of DBT for adolescents with self-harming behaviors. Middle Path DBT is a new DBT skills module for adolescents which reinforces communication understanding, and validation between patients and their families. According to the study, results showed a high acceptability and helpfulness rating of middle path DBT by participants. Results showed that participants found the therapy useful and applicable. Propose an intervention. The findings in this integrative review can improve psychiatric mental health nurse practitioner practice. Evidence-based nursing practice using quality evidence-based research brings quality patient outcomes. Having researched the benefits of DBT in adolescents with self-harming behaviors, I would prescribe this treatment for patients at increased risk of self-harming or suicidal behaviors. This intervention should be used as part of a treatment plan. This intervention could be implemented by the advanced practice registered nurse, such as the psychiatric mental health nurse practitioner. It could be administered in an outpatient mental health clinic. It should be administered by a therapist trained to provide DBT. In conclusion, suicide in adolescents is a major health problem. DBT adjusted for adolescents is a promising treatment for reducing suicidal and self-harming behaviors. Research on DBT as an intervention for adolescents with self-harming behaviors is minimal. However, research should be conducted to provide more randomized controlled trials. However, DBT is beneficial in adolescent suicide prevention.